My name is Dr. Armin Haroutunian. I'm a double board certified anesthesiologist and pain management physician at Century Pain Institute.
And is stellate ganglion blockade safe?
The stellate ganglion block is relatively safe. And like any other injection that I do, it carries inherent risks. Some of those risks include bleeding, infection, nerve injury. Therefore, I think it's very important to work closely with a team to be able to discern who are good candidates and who are not. Turn your neck a little bit more to the left. Good, right there.
Okay, so would you say physicians using the ultrasound to do SGBs, is that a common thing, or would you need specialized training for that?
You definitely need specialized training, so the success and the safety of the injection is really contingent on the use of the provider and the technician that's doing it. So I don't think it's common amongst everybody. Classically, it was done under X-ray or fluoroscopic guidance, but in the last decade or so, there's been a huge push for safety with the use of ultrasound and accuracy. So now we're looking at about 99% accuracy with minimal and less side effects. All right, Deepa, you're gonna feel a little poke and a burn, okay? This is the numbing medication. This is just lidocaine. You ready? A little pinch right here. 1, 2, 3. You okay? That's the pinch. So I'm gonna numb you now. You're gonna feel a little bit of freezing, like a little tiny little bee sting. There you go. That's really the worst of it, so that's the first spot we're gonna numb. We're gonna start first with the C6 block. You can see the needle coming on the left side of the screen here. Bear with me. We're gonna aspirate slowly, make sure we're in the right spot. Good, and then we're gonna inject a few milliliters of the ropivacaine. You'll feel a little bit of pressure here, you're doing great. There's good expansion there. Doing okay, a little bit of pressure. Almost done in this one spot. Good job. A little bit of pressure here. You're doing really good. You're going to see the needle come in from the left side of the screen again, like last time. Over the transverse process there. Right there. We're going to aspirate and then inject right there. You're going to feel some pressure. A lot of pressure. We're almost done. You're doing really good. We have good spread here. Beautiful. Deepa, you are all done.
Congrats.
I'm just gonna wipe off some of the gel. Sometimes we do notice a drop in blood pressure, and that's normal because we knock out those fight or flight hormones. So people get really relaxed, blood pressure drops, they calm. So that's very common.
What can people expect after they get a stellate ganglion blockade?
So after receiving the stellate ganglion blockade, the usual thing I will hear patients tell me is that they can finally take a deep breath and they've got this weight lifted off their chest, and they're able to sleep really comfortably that first night. So in terms of post-procedural, how they feel, from a technical standpoint, they will feel a sense of calm. They will often tell me that they feel much more quieted and relaxed the first day. And I've had patients just basically sleep the day after because they feel so relaxed. They're so used to always putting their foot on the gas pedal to, combat the fight or flight. So once that pressure's off the gas pedal, they're just really calmed down and relaxed.
How long does it last?
So it's variable. Everyone's got different outcomes. People can get months of relief, up to years of relief. We've got patients that have gotten 20 plus years of relief with a single stellate ganglion block. So everyone's different, and you can repeat it for greater success for a longer period of time, and that's a case-by-case basis.
And what are some of the potential side effects after SGB?
The most common side effect we see are a series of symptoms called Horner's syndrome, whereby if the injection is done technically correctly in the right place, then you expect to see these side effects. And these are redness of the eye and droopiness of the eyelid. And so those side effects last about 6 hours to about the day after. It should be completely resolved. Sometimes we see what are called rebound effects. And so the patients will get great therapeutic relief with the block, and sometimes those symptoms of hyperarousal will return when the block has worn off. We don't see rebound effects in all patients, but it does happen. If they're good candidates, a majority of those patients will end up getting a repeat injection for a longer duration of relief.
Okay, so there are a few important details about what you saw today that I want to point out. Number one, I want to thank Deepa for taking part in today's video. I think it was very brave of her, allowing us to record the procedure. The number two important detail that I want to point out is that Deepa was wide awake for the entirety of the procedure. That is a preference of the doc in case the doc needs you to move for whatever reason. Now, if you remember at one point in the video, he did ask her to turn her head to the left.
Turn your neck a little bit more to the left. Good, right there.
And it's a lot easier to make adjustments like that if the patient is awake. You can request to have the procedure done under general anesthesia if you wish. The cost will be higher though, because you'll need to book an OR for the general anesthesia, not the local anesthesia, which is what you saw today. The number three detail that I want to point out is that you will likely need someone to drive you from the appointment because of the calming effect that stellate ganglion blockade can have on the body. Probably not a good idea to drive on that first day. The number four detail is that medications for anxiety, such as Ativan, can be prescribed to be taken 30 minutes before the procedure, just in case you're worried about being anxious. And the last detail, number five, is that as far as I know, stellate ganglion blocks are not covered by insurance, unless you have a diagnosis of complex regional pain syndrome. Please check with your insurance to verify this information. Prices for SGB may vary depending upon your location in the country and the level of expertise of the provider. Please check with the local medical board about the qualifications of someone that you're interested in working with. Just to reiterate, stellate ganglion block is a relatively safe procedure in the hands of someone that's been properly trained. For something like this, safety should take precedence over affordability. If you are interested in working with Dr. Haroutunian for stellate ganglion blocks, you can go to neopsych.com and fill out the contact form. We'll get back to you as soon as possible. If you are interested in pain management, you can contact Dr. Haroutunian's office directly at centurypain.com. I will put both links down in the description for you to view and for you to click on. I hope this video was helpful for those that are curious about stellate ganglion blocks. I wish you all the best of luck with one day feeling calmer and at peace. Take care.